guys doing? This is Coach Elias from Enhanced Athletes, and today I am going to show you the most revolutionary ever created protocol to heal a spinal cord injury and to heal any bone trauma that you've ever encountered in your life. I did a lot of research and I've been holding back because I know this works. I tested some fundamental grounds in the past, but I'm ready to expose it to you guys because if you went to my first video, you know what happened to me. Make the story short, I fell from 3 stories from the roof and I broke my C7 vertebra and my T1 vertebra. I also fractured my tibia and I broke my tendon in 2, and it has like a little slice. I saw the bone, but the thing is, the protocol. Let's go to the protocol. I'm in deep pain. I want to do this, so I want to do something different, and we're going to be doing something that goes directly into the bone. But we're going to go to the bone in 2 different pathways. So first off, I'm going to show you my wrist. Over here, you're going to see that you see that little circle right there. If we go in there with a syringe, you're going into an arterial wall. So you're hitting the main artery. That artery connects to every bone in the body, meaning you're going to have a better healing, arterial healing. And we're going to be using 2 fundamental peptides that are the base of this protocol, and I will expose every protocol, everything from A to Z. So bear with me. Okay, so we're going to be using today osteogenic growth peptide. Osteogenic growth peptide is a peptide that's a novelty peptide. It's been created to heal bone structures, to heal the bone. But there's a problem. This will heal the bone, but you need to open pathways. And scientists was always thinking how to do this. How to open a pathway to heal the bone, because it's really different. The mechanism of action that we're going to be using is something similar to mechanistic growth factor, but using the echo channel. Now, for that, I only have one thing, one single compound I found. It's another peptide. So we're going to be using 2 peptides for the base of this protocol. And the other peptide's name is AC100. AC100 is the connector, and it opens 7 pathways to the bone that I will mention. These pathways, the most important thing that you understand, is made to do something really, really nice for the cell lines. Now, this is right in the middle of the bone. You see those little crevices. So the pathway to osteoblastic healing is done with these 2 peptides. Remember, OGP and AC100. Now, the only thing I'm looking here for is for proliferation. I'm looking to heal the apoptosis. Basically, you know, the inflammation that's caused when you broke your bone, that I need to go there, but then I need to make sure that angiogenesis is done properly. So this peptide actually creates expression of the ALP, and that's exactly what I needed, because we need to do something to that so it could bind directly into the membrane. And if you think about healing, and if you think about the bone, we need to make sure that every pathway is open. So when we actually open up this pathway and it's binding to the new membranes, it's going to create fibronectin. Now, fibronectin and collagen, how do we do that? How is collagen present? It is. So what I'm doing is I'm grabbing the fractured bone, the area that's destroyed, and I'm making the body using these two peptides as a base to reconstruct, but basically to metabolite and to create organic matter that's organic human collagen to heal. And it's going to use that as a vehicle. So right now we're going to have collagen and fibronectin exposed in the grounds where you have that tear or that rupture, fracture, whatever you had. Now that we're following through in this video, we're going to bring all that collagen to create what? Cartilage. When we create cartilage, it's going to convert into what? To bone. Now that we did that, we have healing, right? Some healing. But there's other things we need to talk about. We need to regulate TGF. We need to regulate not only TGF, what is it, the growth factor. It's kind of similar to IGF, but let me talk about B1, B2, B3, and FGF2. A lot of people only know IGF, but there's a lot of growth factors in the body. But right now I need FGF opened, so it could create pure IGF and trick the body into transforming into mechanon growth factor echo channel. So when we do that, all that's happening is that we're building a rock pathway. It's literally scientifically called the rock pathway because it's making your bone mature. That's going to heal properly. And now you're going to be fresh and brand new. The doctor said it should take me 8 months to heal. And I think that I am going to prove him wrong. And I'm going to show the world that I could do it from 8 to 14 days. Injecting and doing this protocol properly. I will talk about the other peptides we're using and the other compounds we're using in a minute. Now, arterial healing. Well, let me tell you something about arterial. Whenever you fall from really high and you hit the ground and you bounce like I did, they have to automatically take you to the hospital, a trauma, intensive care unit. And the first thing the doctor has to recommend is a arterial oxygen test. So they will inject you with a needle that only has air, basically. So they'll basically put it inside and just try to pull. And they'll pull blood from the main artery to see how much oxygen is inside that bone. Well, with this pathway, we're opening up every pathway to create more oxygen. Oxygen is the building block that is carried over by what? Iron. And that multiplies, creating IGF, creating a better synthesis of proteins in the body. But we did need something else. We did need something else, right? Yes, we did. Well, you guys know what fragment 176191 is. And it's used just for a cutting base. We could use that for cutting, yes. But it's a fragment from what? From human growth hormone. But since I'm giving it AC100 that has what? Mechanon growth factor echo channel. We're just transforming it now into a hardener. And it does harden. And I could prove it to you. Look, when you inject your abs with my protocol, with fragment 176191, sometimes you see a formation, like a little knot just sitting there. It's creating a root and pulling the muscle out. So you get really, really, really what? Cut. So basically doing the same thing for our bones. So yes, how much did I use of this? I will be coming back and telling you guys. But that I did need to include, and not much, just a little bit. I'm talking about only 5 IUs. That's nothing. Now, after this, we have encountered one single issue. We needed to find a way so every single IGF channel was open, and we did. We did. That's why I included TB500 and BPC157. These, if you mix them all together, and thymosin alpha 1 mainly, these 5 peptides are going to be the building block to heal you completely. So remember, please, if you want to enhance your VEGF, and this is our vascular endothelial growth factor. I know you guys only know like mechanism growth factor, just a little bit of others, but we're actually going to what? Vascular endothelial growth factor. We need that open. We need that working. We need that because there's actually 3 of them in 7 pathways. So giving these building blocks, putting together in synergy, OGP, which is osteogenic growth peptide, also AC100, also fragment 176191, also alpha, hold on, BPC157 and thymosin alpha 1. Okay, I'm doing my best not to I'm doing my best to continue the video, so let's keep going. So we have these 5 peptides, and I'm using 20 IUs of TB500. I'm using 20 IUs of BPC157. I'm using only 5 IUs of OGP. I'm using 5 IUs of AC100. And I'm using 5 IUs of fragment 176191. And each time I'm injecting. So I would inject directly into the actual region where the problem is. That means spinal cord. But first day, right here. Right there. So I want to show you guys so you see. So you're basically touching exactly where you feel the pulse. And I would go in like this, outwards, in a 45-degree angle, straight, and putting the needle halfway, and actually putting a 1/2-inch needle. Injecting the peptide, take out, and do it again in the where your bone is broken, tibia, and then in the spinal cord. You need a high dose. That's why I microdose these. So at the end, you're gonna have, I'm injecting in 4 places. I have exactly 20 IUs of everything every time I do the protocol. I do it 2 times. I do it in the morning and I do it at night. But when you have an exposure to the bone, my bone was exposed, you need probably antibiotics. So I'm going to share with you antibiotic that you should have in hand, you should find, and you should always include in this protocol. And it's called ceftriaxone. This is 1 gram ceftriaxone, right? So this comes in a powder form, and you reconstitute it like any peptide. This BPC157. This over here is TB500, and this over here is thymosin alpha 1 with OGP, with AC100, and fragment 176191. So, what else could I use to enhance my healing? I need something to actually grab all the inflammation and bring it back to normal as fast as possible. As fast as possible. So basically, I'm inflamed. And for that, I have this little bad boy. This is dexamethasone, right? So dexamethasone, sodium phosphate, it's 4 micrograms per ml. So I got 1 ml I am injecting into the glute, and I promise you will feel amazing. If you have pain medication, I could say what I'm actually on is tramadol. I have Mobic, and they gave me morphine for the pain. Now, I'm going to show you guys that this actually works. I want to pin it right now. I really do, but the video is getting too long. So I'll make another video where you could see me inject, but I will show you in this video where I would inject, or maybe I'll inject and then I'll edit the video. Always for entertainment purposes anyway, right? You know, I'm not angry. Yeah, let me inject. So I'm gonna go ahead and pull yeah, it's a 5, right? 5 of TB500. Okay, 5 and BPC 157. The reason I left the OGP and the AC100 in the refrigerator is because I only have 2 boxes of each, which is 20 little of these, and it's really fragile. It's really fragile, and I don't want it to break. I don't want it to, you know, have any concern, any issue with it. And these are really cold, the ones I have, but I don't want to take a risk and lose them because I want to heal. So I'll be using about 2 vials a day. I'm only reconstituting every peptide with 1 ml of backwater. So in this case, I want to tell you a little secret number that I want you to remember, because I cannot tell you something else, right? But you really want this. You really want to get it. You really want to get it, right? So, cast number, and you do your research. Cast number 132996 61 3. You're welcome. And then, if you have any questions, please DM me and I will show you. So for now, I think that's what we're gonna be doing. I just feel like you guys need to see how the rock pathway is done using arterial healing. So let me show you really fast, if I could. If I show you my, oh, okay. So basically, that's where the bone, here and here, they did stitching, and I would go, oh my God, I would go here. So I want to show you how I do it. See, I'm going all the way in the bone, as far as you can in the bone. See, it's almost all the way in. So I touch the bone, and exactly when I touch the bone, I start putting it in. Okay, so that's done. I just want to make sure that you guys see I'm not fucking around and I'm actually doing this shit. So the next one, I can't reach my spine, but my wife's gonna do it. This is my second day, and I promise it's gonna work. Now, really important, you only use 2 of these max if your inflammation is still really, really intense. So what is this? This is called dexamethasone. Dexamethasone. It's basically Decadron. Decadron, but an injection. So remember, we have Decadron, dexamethasone, and this one is dosed 4 milligrams and 1 ml. We go ahead and inject the entire thing into the glute. Now on this one, it's really different. You could do it with an IV. If you know how to do an IV, like I do, then you could do it with. Let me just get it really quick. Hold on. Oh my god. Hold on. Sorry. Okay, guys. So you would use this. This is gonna be next. So I only have one more day of this, and I would put this entire thing here and I will let it drip. It will give me hydration, and I could put injectable medication in here like for pain, and it'll still go through and you will feel much better. Now the reason I put this in here is because this actually is the only route that I could use. You have to use this route. Now I've done it before where I inject into the glute, yes, and you can, literally, I am, but it burns and I'm already in pain. So, and then it leaves like this burn, severe burn, but you could feel it when it's passing through your vein. So just saying, if you're gonna be using ceftriaxone, don't get the pill, man. Do it with this, because that means it's a bigger life, a better effect. Everything's working in synergy. You're buying transforming medication faster. That means you're not allowing anything to damage your immune system. I'm also taking 2,000 micrograms of vitamin C. And of course, just do your best. Try to always move. He told me not to move. He told me to stay 30 days in bed, which I'm not going to do. The reason I'm not doing it is because I believe in science. I believe in freedom. And I know they hide so much shit from us. These peptides, they're not new. They've been out for a long time. And they only use it in 33 countries where they're legal. And these are legal compounds. Everything's legal here. I don't know why doctors do not do the purgles right. Why are you gonna put a patient through so much pain and not tell him how to like get better? Oh, here's some Tylenol, here's some Percocet, or here's this. Yeah, just lay in bed and eat in order. Yeah, you gotta have a diet. Yeah, but man, if you have peptides, you just fixed yourself forever. If you have peptides, and if you have this exact protocol, you're going to be in shock how fast it works. And you will see, I guarantee you, not 8 months, but like I would say like in 2 weeks max, I'm going to be like brand new. And I am in pain. I am in really, really hardcore pain. I know the wolf knows. I know Allie knows. I know a lot of my clients, a lot of them. Thank you also, please, man. Like, I really appreciate you guys, man. Like, you have no idea. Everyone that made a comment, that wished me the best. I found myself in this situation, and you gotta stay positive. And I am so positive that this is gonna work, that I mean, there's no other way. It's gonna work, and that's it. It's gonna work. So let's just do a really quick review with dosing. So I'm gonna use a little bit more concentration, and please grab a pen and paper and write this down. Okay, so first thing you're gonna do is you're gonna write down the cast number: 132996-61-3. That's the cast number. Now, first peptide that it's the base is what? Is OGP. OGP stands for osteogenic growth peptide. Osteogenic growth peptide, right? It's going to be the bone healing miracle agent. It's 14 amino acids, and you're going to inject in 4 areas. You could go or 3, but you have to take 20 IUs daily, 2 times a day of this peptide. Then let's go to the next one, AC100. AC100 works with the what? Mechanism growth factor channel echo. This peptide you're going to do only how much a day? 20. So you're injecting in 3 spots. You got to make sure it's like 7.5, and I don't know what else. Just inject it the same amount. This is the perfect amount. I've been doing a lot of peptides. I'm an expert with peptides, and I could tell you this is a perfect dose. Now, what else are we going to use? Remember I told you I had a problem where we needed to find something to enhance that pathway, right? So fragment 176191, I really want to use it because what does it do? It hardens, and it gets you cut and lean, and it burns fat. We're not using the growth factor. We're not using the to grow the bone or anything. This is directly for muscle, but for tendons, I'm using that. I'm using it for the bone healing, and specifically, the reason I added BPC 157, which is the other one you're gonna put down, 20 I use 2 times a day, is because I love it for it heals tendons, ligaments, bones, the stomach. It's a protocol for it. It goes perfect for injuries, for muscle injuries, for anything, and even for the brain. It gives you like this state of perfection. You feel so amazing. And I want to tell you a lot more, but little by little, right? So the next compound that we're going to be taking is thymosin alpha 1. Thymosin alpha 1 basically is something that it's my favorite. It really is my favorite. If you have like elevated liver enzymes, they're eradicated. You got like baby enzymes again. They could be at 9,000, let's say. I had mine one time at 900, which is crazy. 1 week with it, boom, 33, 31. I'm like, what the heck is this? Yeah, and I did take other peptides, but the thing is, thymosin alpha 1 is known in 33 other countries to be the only prescription grade medication, peptide, medication to heal hepatitis, to cure cancer, to cure a bunch of things. That's what they say, and guess what? That's what I found out is true. So, hey, I'm just saying this for entertainment purposes, right? So yeah, how much of that? 20 I use 2 times a day. And then of course we're going to be using TB500 because it also works in synergy with thymosin alpha 1. Thymosin alpha 1 was the first peptide made, and then TB500 was made from that. It's a little bit stronger, and it works great with AC100. And it opens up the B2A2 factor. And when I'm talking about that, I'm just talking about the K and S channel. K and S channel is something that happens inside the bone, where you see B2 Bravo 2 alpha expression, and you're just allowing angiogenesis to happen, so you're healed properly, basically. Um, so that's what we're gonna be using, and then what else? Oh yeah, you got the ceftriaxone. This is what, an antibiotic. If you need the antibiotic, take it. And then the decadron, and that is it. That is everything in my protocol. Um, I do have a really nice diet. I feel that you guys are going to be doing great, and I will come back to you guys and tell you how it went and give you an update on this protocol and my recovery. This is video number 2 of the recovery series. Thank you for watching. This is Coach Elias from Enhanced Athletes. Thanks. We're doing this one now. We're going to the spine. I know you guys want to see the spine, but that's going to be in the other video. Talk to you guys soon. You guys wanted to see this one, right? See, I'm actually using it. Pulling everything out. See? This one I'm going to put in my hip. You know, last one I did it in the glute. So this one, I'll do it in my hip. Only 2 times the first week. If you need to take one more, I would do only max 3 vials of this, because this is actually amazing. You're gonna feel like $1,000,000 after you inject it. You feel like you could do stuff. It does wear out, but it takes a while for it to wear out, so you feel great during it. And I highly recommend you get a prescription for it, because the doctor that gives it to you is going to be amazing. You guys know you can count on me. I'll show you a lot of other things. DM me. I know you guys wanted to see this. It's not over. So, hip, right? You're going to do like a V, and you go right in the middle, right? So, all the way in. See, it's just for entertainment purposes. I'm just cleaning with water my, yeah, my thigh. Yeah, there we go. Here we go. That's it. And I love this part. So basically, now in about, I would say, oh man, I'm starting to feel good. Okay, so just a little review. It's been about 10 minutes that I injected into the tibia, theoretically, right? So I am feeling, what I'm theoretically feeling is a little itch. I feel it went inside the bone where the rupture or where it caved in. That's where I feel it, and it feels good. It feels like a cool feeling. It's cold. It's like a cool feeling, like something is working. So you have no idea how good it feels to, like, you know, you're fixing yourselves. This is like why I defend so much freedom. And I know this, I'm not shaved or whatever. I just, you know, sometimes you just gotta make the video. And I haven't been making videos for a while. I've been so clustered with so many clients and work and hurricane and then this. So I said, you know what, let me just push through and do this. So that's what I'm doing for you guys. So let me know what you want to see in the next video. And I'm gonna go ahead and make another one. Hopefully it's gonna be 100%, and or I'm gonna do probably tomorrow the other day. You know, I'm doing this every day, max 2 weeks. But I think it's working. So now the spinal cord one that you guys want to see, I'm gonna film that too. Don't worry, I promise. I'll go ahead and do it. And thank you guys. Have a wonderful day. Go Chelias out.